Welcome once again to this good morning. Speak into the mic. Thank you, Tracy. I will do my utmost to speak into the mic. Thanks very much for that. So I think you know our team. You've probably met us virtually many, many times. This is a lovely stretched picture here, but Dr. Higginbottom, very grateful to him as always. This work is indeed his brainchild, so we're thanking him very much. Regina, you've heard from me. Big thanks to Jordan. You'll see his lovely picture there. Technology support. He really saved us this morning. So we are very grateful to Jordan. Thank you very much, Jordan. Manny, the left-hand picture, and Jen, our team. So big thanks to Jen and Manny for lots of excitement. We've been at this for about an hour and a half trying to set up. So yeah, there you go. Anyways, we've been doing these smoothly for a very long time, but this morning was a really must be added challenge. But anyways. So Carmen, thanks for the warm welcome too from North Vancouver. We appreciate that. And then you know that really what we're trying to do is just advance education in mental health practice and evidence-based practices. We really appreciate very much your good feedback. Many of us give us superb feedback and some critical feedback from our last session. Please know we read all that stuff. We're very, very grateful. So we thank you for taking the extra moment that it takes to give us some feedback. So thanks very much for that. So yeah, that's the evaluation piece. So just love to hear from you. So it is my great pleasure to introduce Tara today. So Tara is a certified recreational therapist. She has served mental health clients for over 7 years while working at the ECHO program. Those of you who know about Canadian Mental Health Association may know about the ECHO program. Tara created a particular group around love, sex, and relationships to support mental health clients in exploring their sexuality and acquire skills in developing intimate relationships. Tara also successfully completed the Sexual Attitude Reassignment course, certified through the American Association of Sexuality Educators, it's a long sentence, at counselors and therapists. She is passionate about wellness and believes in stigma associated with sexuality and mental health clients. So with that, we are just going to switch over to the slides. So be aware that they may just roll, but we're going to do our best to keep the slides in the right place as Tara is speaking. So just give us a second. We also share the camera, so you'll see Tara.
Oh, great.
We didn't actually give Tara a lot of leeway into that, but thanks for agreeing to do that. So to get us organized here, and there we go. All right, over to Tara. Thank you kindly.
Great. Hi, good morning, everyone. Thank you for your patience. I had no idea I was going to be on film, so that's an interesting added thing. I want to make sure. Hi. Thank you so much to the BC Psychosocial Rehabilitation Advanced Practice for having me today, and thank you to Jen for inviting me. I'm really happy to be here and share some information with all of you listening today. I know we have a chat window and someone's going to be manning that, so I really just want to open up the conversation and support dialogue here. I know that this topic is often associated with a lot of stigma. I'm hoping that after today that perhaps some of the mystique is lessened and that we feel more comfortable promoting this work within our mental health setting. I did not come here as the expert. I'm simply here just to share some ideas of some of the work that I've done in promoting this and just to showcase some ideas. Only you know your individual clients, only you know your individual work settings. I just want to really create a safe place for us here today, for you to explore your thoughts and your attitude and belief systems in love, sex, and relationships.
Good question.
Perfect. Perfect. So these are, sorry, there's lots of giggles happening on this end. These are the expected learning outcomes today. So just to understand the needs of clients living with mental health challenges and developing healthy, intimate relationships, to explore current research supporting the need for professionals to address relationship building skills with clients, to develop an understanding of sex positive culture and talk about how can we promote this, to give participants an opportunity to explore your values and worldview in relation to sexuality, and just for us to have a dialogue about challenges in supporting mental health clients and healthy sexual expression. Sorry. Okay. Oh, I'm going to let you do that.
Okay, super good. I hope that I can do that.
All right. Perfect. So, according to the World Health Organization, sexuality is an important part of how we view ourselves and is fundamental to our health, our quality of life, and our general well-being. So, in mental health settings, we are often discussing a range of topics with our clients. We talk about income, we talk about hygiene, coping strategies, goal settings. And I know that we often try to make plans holistically to support our clients with their health and wellness, yet often sexuality is a topic that is not explored. Stewart, Leisker, and Davis define sociosexual functioning as not simply engaging in sexual or social relationships, but in maintaining more socially intimate and committed or attached sexual partnerships. Oh, people are saying they're having some issues. Okay, sorry. Due to social isolation and limited social supports, people often with mental health concerns require practical support from their social service providers in developing their relationship building skills. We're not taught as children or as adolescents on how to date or how to have healthy, intimate relationships. And so depending on the age of onset for folks, when they have their first episode or what's happening in their lives with their mental health, there seems to be a real disconnect in terms of that social development piece for folks to learn these skills in a practical way. So I'm going to go into some of the literature that I've reviewed. I just kind of want to make a bit of a disclaimer before moving forward. So this is not necessarily a reflection of my personal worldview. This is just what the literature is saying, and I'm just trying to share this information for just to reflect the need for professionals to support this dialogue with the clients that we serve. The people that we work with are complex human beings with many pieces to their lives. I think that's just important to mention. So due to limited social development and desire for connectedness and intimacy, mental health clients can be impulsive, can make poor decisions, and tend to have sex sooner. This is what the literature is saying. Often, I know in the work that I've done, I'm often hear folks reflecting on how there's sexual trauma and some exploitation in some folks' past, and so that can really be difficult in cultivating intimate relationships and having a lack of trust for people. So again, I really see this as an opportunity for mental health professionals to play a key role in supporting clients working through these difficulties post-trauma through a safe and supported therapeutic practice. So due to low income, some of the folks that we work with are on, some kind of social assistance. So accessibility to birth control and condoms can be very limited, which makes people vulnerable to HIV or STI, unwanted pregnancy. And we know that sexual dysfunction can occur depending on certain antipsychotics or antidepressants that people are taking. I know that some of the young men that I've worked with in the past, have reported that, and it can be a real problem in terms of medication compliance and feeling connected and having, a sense of identity can really be impacted there. So I just want to share a quick story about a client that I was working with. So he was a participant in the love sex relationship group that I ran, and experienced this, and had a conversation with me and was like, I'm concerned that women are going to be upset and not want to date me because I can't actually have sexual intercourse with them. And so through part of our group, we have anonymous questions where people can ask questions, and we kind of put it out to the group, and this is one of the questions that was addressed. And it was really amazing to see so many of the women in the group say, that's not a problem and that's not an issue, and we would rather feel a sense of connectedness and intimacy with our partner. So that was really nice for him to hear that. So. So the literature is pretty clear in terms of identifying two specific vulnerable populations, people in the lesbian, gay, bisexual, queer, trans community. Folks are often supported in their gender identification and their sexual orientation, but there seems to be little information to support, them actually getting some support in how to maintain a intimate romantic relationship. Or there seems to be, focused on STI or HIV prevention. And I think that this internalized shame and rejection, can really promote that message of stigma around, sexual education being the primary and not necessarily talking about how do we promote these intimate, connected relationships and not just perpetuate that stigma around, not engaging in sexual activities. And young adults, another population that's identified. So young adulthood, culturally, this is a developmental period where casual sex seems to be kind of widely accepted. The difficulty of this with people that have mental health challenges is it can kind of be this cyclical effect where they're having casual partners, they're engaging in sexual activity as a way to self-soothe, but then they're engaging in that, and then that feeling of isolation and loneliness can really impact their health, putting them further at risk. So it's going out, engaging in sexual activity, trying to self-soothe, trying to feel better, going home, feeling isolated, depressed, engaging, and it can kind of be this cycle. So there's a real need to support young adults with, developing these skills.
So we do have a couple of questions popping up, but how about will we just take them at the end? Is that your preference?
It doesn't matter.
You don't mind? So we had a person online just asking, how do we help people consider their medication when it may have repercussions on sexual performance or, it may have implications?
It depends on what your role is. I always had people come to me and talk to me, and I always refer them back to their case managers or their psychiatrists. And there's different cocktails essentially that folks can take, and reiterating the let's weigh the pros and cons, and let's have a conversation about the impact. If people are saying, I don't want to take this medication because I can't have sex with my girlfriend, then I would say, okay, well, let's have a conversation. What happens when we're off our meds? What does that look like for your relationship? What does that look like for your life? And refer them back to talking with their team, because those are all important factors I think that we need to consider, and exploring ways for connectedness and intimacy that don't necessarily involve actual sexual intercourse. And I've had conversations with clients around, connecting and touching and kissing and stuff like that, and that seems to have worked from my end at least. But always, let's have a conversation, using kind of motivational dialogue in terms of why is this meaningful for you to be on medication? How does this impact your life?
Great. Thank you.
Perfect.
Next one.
Great. So again, the literature review that I did, there's definite gaps in the literature, of course. So again, what I was talking about, this, terms of sociosexual functioning within the LGBTQ community. So there seems to be a real focus and not necessarily in the LGBTQ community, but with mental health clients as well, around promoting kind of platonic relationships. And there seems to be less focus of discussion on intimate romantic partnerships. And it really remains unclear around specifically what are the factors necessary in supporting the clients that we serve in developing healthy sexuality and intimate relationships. And this I really want to reiterate, going to your team, having a conversation, and gathering, doing a needs assessment, and what do we need to do to support the folks. So now I'm just going to give you a bit of information around kind of how did this all start. So my background, I was working with, I worked in a group home with at-risk female youth that were under the ministry care. And so I lived in this group home. And so it wasn't unusual for me to be, making a pot of spaghetti on the stove and having conversations with the youth and being like, how was that test today? Just a reminder that we have, we're meeting with probation tomorrow, and I picked up condoms today. And that was just a normal kind of day-to-day for me. And so when I started working at the ECHO program, I looked around and I was, working with the young adults, and that was my scope of practice. And so I was really fortunate that I worked on a team and worked with a team leader that really supported me in kind of thinking outside the box. And so when I went to her and said, where are the condoms? She was like, well, what do you mean, where are the condoms? And anyway, long story short, I ended up going and connecting with the BC Centre for Disease Control and setting up a harm reduction program with the Canadian Mental Health Vancouver Fraser branch, and brought condoms in. And I learned, I had the reputation at my work of being the condom girl, and and I really I liked that title, and I owned that title. And so when people saw me at staff meetings, it was, there's our condom girl. And so it was just kind of this fun, normalized way of promoting this. And even within my own peer group, my friends know me as the condom girl, and I always have condoms on me. And it doesn't matter if I'm out socially, I'm handing out condoms everywhere I go. And just to kind of promote that normalization of it, and to just, decrease the stigma. And so that's the condom girl story, which people always find really funny. And then the next thing I did was we brought in guest presenters. So we had someone come in from AIDS Vancouver and do a presentation on healthy relationships and boundary setting. And after that presentation, I said to everyone, okay, well, what now? What now? And everyone was like, we want more, we want more. And then we brought in a man named Michael Crane, and he was working on a research project with Conquer in 2013, around just sharing, the needs of mental health clients with dating and intimate relationships. And again, it was really interesting to see that the needs of mental health clients, in terms of that desire for connectedness, and that desire for intimacy, and that desire for relationships, it's all the same as all of us. We all want to feel connected, and to feel a sense of belonging, and to feel that love. And again, I'm like, what now? And everyone's like, we want more, we love this. And anyway, so at the time I was running a social skills group with an occupational therapist from Burnaby Mental Health, Peter Firminger. I could go on and on about this man. He really is a brilliant practitioner. And I said, hey, you want to do a group with me? And let's talk about love and sex and relationships. And Peter, if any of you know Peter, he was like, sure, all over it, on board. And so we had a meeting in my office over a cup of coffee, and this group was only meant to be, let's just open up the conversation, and let's start the dialogue, and let's introduce it and see what happens. And we really had no idea where this would grow, and it's really amazing the support we've received from Fraser Health, and from management, and from my agency, and everyone across the board.
Great. Next slide. Oops.
Oh, okay. So on this particular slide, I did have a few key points that I wanted to address in terms of if you're going to promote this group and you're going to create a poster for it. Obviously, normal information in terms of, topics covered, how to sign up and stuff like that. But I had a few key points on the poster that I think is worth mentioning. So we live in an age of technology. We know that online dating is happening, and things like. So I actually had a graphic on the poster representing online dating, and then because I am an LGBTQT ally, and I think it's really important to create space for people to feel included and to feel connected. And so I had a rainbow on there to allow people to feel included. And represented same-sex couples. And but the other piece that I added was it's a symbol, and it actually is promoting folks who are polyamorous. And we have no idea what the people that we serve's values are or how they connect. And so I really wanted to make sure that on the poster, every group was represented. And if someone identified as, within any of that, I wanted to make sure that they felt included and they were represented. So that was really important for me when I created the poster. So the group that we ran, Peter and I were really lucky. I think if we go
Next slide.
Yeah, sure. So Peter and I was very fortunate to run this group with him. I felt there's value when you run a group when both genders are represented. And Peter is older than I am. And so, again, it really was great having both of us representing different pieces. So we had the youngest participant in our group was 23 and the oldest participant was 71 at the time. And I can honestly say the conversations I had with anybody were great, whether they were 28 or 65. And one particular conversation with the 71-year-old, she was so fabulous, and she was talking to me about her boyfriend, and she was really upset because she was saying that, when I make love with my partner, I say that it's making love, and he doesn't say that, and I'm really upset because it's really important to me. And so we ended up having this really beautiful conversation around language, and she really wanted to make sure that she was heard, and she really wanted to make sure that her partner knew that this was a very intimate connection between them, and she felt like she was making love with him. And when he wasn't using the same language, she didn't feel valued. And so through that conversation, she went and had a conversation with her boyfriend and came back and was, Tara, it was so great, and he heard me, and now he's using that language. And so, yeah, it was really good. And then with Peter, he would make examples of, when we were talking about different types of, kind of connecting and kind of hooking up essentially. And he was using phrases like, petting. And then all the young adults would start laughing. And then I would look at him and go, petting? What is petting? And then he'd look at the other folks that were older in the room, and everyone would go, yeah. And then the young adults would talk about sexting, and then we'd have people in their 50s and 60s going, what is sexting? And so we would have these brilliant conversations where people were learning and laughing, and it was just this very normalized way of connecting and sharing those views. And I have really fond memories of some of those conversations. Okay, so this is the group. It is a closed group. We did screen. I know people have mixed thoughts and feelings about closed groups. We really wanted to make sure that it was a safe space, and we were very mindful of our group dynamics. So we did screen to make sure that people were aware that we were talking very openly and candidly about sexual topics, and making sure that no one was potentially going to be triggered or have any concerns there. So each week, the way we structured the group, the intimacy grew and the depth grew. So we kind of wanted to warm people up in the very beginning. Let's talk about the group. Let's talk about, why do you want a relationship? What do you have to offer? And then week 2 was where to find people, and talking about, places to explore. This is where we talk about online dating. And then the 3rd week, we talk about managing anxiety and managing our safety, and talking about making sure that dating is stressful on anyone, and it definitely can impact our mental and emotional health. And so week 3 was when we really got into that self-care piece and safety. And then week 4 is when we talked about sex. And I would say that, we had almost 45 participants go through this group. The attendance was, I think we were at like 95%. People did not drop out. They came. Some people took the group a second time because they found so much value in it. And again, it was always, we want more, we want more, we want more. So there's a real desire from the folks that we work with in terms of let's have this conversation. And I would say every single participant would come to me and say, thank you so much. Thank you for holding space for us to have this conversation. No one talks to us about this. And I think there's a real gap here, and there's a real need for us to be of service to the people that we work with in terms of supporting them and giving them some practical tools.
Mm-hmm.
So we're going to talk a little bit about kind of the sex positive culture promotion. So I was really fortunate and went to a seminar that was put on by the Institute for Sexuality, Education, and Enlightenment. I highly recommend this agency. They operate out of Connecticut. You can go online, instituteforsexuality.com. They have webinars. That's where I did the sexual attitude reassessment course. There is opportunity. It's a American company, but there is an opportunity to. They do run what's called SAR up in Canada sometimes as well. So if anyone is interested, I highly recommend going online, checking out their website, seeing what webinars are available, and connecting with them and seeing when they're offering some programs in Canada, because it definitely opened up my understanding and my awareness around this whole kind of sex positive culture. So according to the International Society for Sexual Medicine, the term sex positive can be interpreted in different ways. For most, it involves having positive attitudes about sex and feeling comfortable with one's own sexual identity and the behavior of others. So there's a few kind of traits that they highlight. So open to learning more about sex and sexual activity. Consider sex to be a healthy part of life that should be enjoyed. And like I said in the beginning of the presentation, that the World Health Organization is supporting this as being a fundamental part of our health and our well-being. And the last part, which I know this bullet might be
Probably just
okay. So the last one is talking about accepting others' sexual orientations and lifestyle and sexual practices as long as participants are safe and consent without moral judgment. So I know that there are, lots of divergent, essentially, sexual practices, and that don't necessarily align with your personal values and belief system, and that is okay. And so this whole sex positive culture promotion is really about just trying to suspend judgment and have conversations in terms of just supporting the clients with where they're at and trying to suspend judgment as much as possible. And that was one of the things that I learned at this SAR webinar or this SAR conference. It was 3 days. Was sexuality is from a place of pleasure and joy, and that people experience pleasure and joy in their life with lots of different things, whether it's a recreation or leisure activity, whether it's a sexual practice, and we have to try our best to suspend judgment of what people do that makes them feel good that maybe we don't understand. But just I keep using this frame or this term in terms of holding space. This work that we're doing, that I'm doing, that I'm promoting, is not necessarily to say yes or no. It's really just to take a moment, have a breath, take a step back, and to hold space and to allow our clients to explore what's meaningful for them. And that's really kind of what I'm trying to do here.
Mm-hmm. One more?
Mm-hmm.
Okay.
So what now? This is really an opportunity for you to do a self-check. in terms of, you're a practitioner, you're someone who's in the field, where is your level of comfort and where are your hard edges? Where are your limitations? I can honestly say that the conversations that I'm having with clients are not how do I do this? It's more from a place of just wanting to have a conversation. I'm going on a date, I'm feeling kind of anxious, walking them through how do you take care of yourself before the date? How do you take care of yourself after the date? Safety. I remember having a conversation with a woman, and she was someone who historically brought people back to her place and often felt pressured to have sex and really didn't want to do that. And so she was having a talk with me to say, what do I do? I really want this guy to like me. I don't know what's happening. And so we had a conversation, and I, was saying, okay, well, why don't you go for coffee or do something in public, and, and don't bring them back to your house. And she was like, okay, I can do that. And so, and then the next day I saw her and I was like, how was the date? How did it go? And she was like, it's really great. I didn't bring them back to my house. I'm like, that's great. And she was like, I went back to his house. And I realized in that moment that it was very black and white for her. Like I said, don't bring them back to your house. This is for safety. And so she got that. She was like, okay, this is for safety. Don't bring them back. And then I realized, okay, but she missed the disconnect around don't go back to your house or his house. And so she was really proud of herself. And, but we really needed to open up conversation to be really clear. But I can honestly say that, my comfort level I know is pretty big, and there's not a whole lot of things that I'm not willing to talk about. But I know not everyone's like that, and I really want to encourage you to check in with yourself. And, open up dialogue with your team. If you're on a team and this is something you want to bring forth, do so. I was really fortunate that I had the backing of Fraser Health, of my CMHA management, of my team lead, on my team itself. There was a wide range of comfort within my team. And, people would go to our staff and try to have conversations, and they would go, oh, this sounds like a conversation we should bring Tara in. And then the three of us would sit down and have a conversation. And so it's really just about knowing your team, having a conversation, opening up that dialogue and saying, this is something that I find value in. I feel like we need to just open this up and see where everyone's at. Talk with your clients. So assess the need. The people that we serve are the experts. They're the experts in their life. They know what they need. They know what is required for them to feel safe. And, just have conversations with people and ask those questions, or really see where the need is for them. And, connect with your local health unit and inquire about bringing in harm reduction supplies. So when I brought in condoms, I made sure that I had regular condoms, and I made sure that I had flavored condoms, and I actually had on the bowl that was the flavored condoms, this is for oral sex only, and had that education piece with people around not wanting to use flavored condoms for intercourse because it can promote yeast infections. So these were just normal conversations that I was having, like, on the floor. And we brought in packages of lube. I don't know if people are engaging in anal sex. I don't know if people are having challenges because of medication with lubrication. So again, at our front door, very accessible. People could be walking out the door and grab a handful, different options for condoms, lubrication, and just, you can have conversations with your health unit to see what's available to bring into your site. And connect with local resources. I'm a recreation therapist. This is going to be a shout out to my fellow Douglas College Therapeutic Recreation. We have service learning projects. Connect with the college, connect with the programs, nursing, social work, and say, hey, we're all busy folks. We do not have as much opportunity as we'd like to have program development. Connect with your students. These are the up and coming professionals, and get them to come in and do presentations, get them to come in and to connect. Programs, that's part of the requirement, is to come in and to connect and to do this work. So it's really important to, you know, look into your community resources. Who can come in? Who can do this work? So I just kind of want to open up conversations. I know people have lots of fear around this, and I get that. And I hear a lot of people talking about misunderstandings. I did a presentation with some occupational therapists in through Vancouver Coastal. Every single time I present, all I'm hearing is, thank goodness, this is such important work. It's long overdue. Some people are saying, I'm glad you're doing it. I don't want to do it. And other people are like, hey, this is really great. I'm interested in doing this. So I hear people sharing things like, I'm concerned there's going to be a misunderstanding with my clients. I'm concerned that they'll misconstrue my opening up this conversation as a come on or something like that, or it will impact my working relationship with them, or I'm worried about putting a case note in Paris and have a case manager look at it and say, why are you talking to Joe about sex? And so I always say, communicate with your team. If you're having a conversation with Joe about sex, you're on a care team. Have a conversation with your case manager. Have a conversation with people you're working with, and know that that's a goal that you're working on and a topic that you're talking about, so there is no surprises. I have yet to have anyone misconstrue me with opening up this conversation with them as a come on. I've yet to have anyone say any crude or outrageous comments to me. People, I don't know, that's not my experience. I've been doing this work for 3 years, and all I hear is gratitude and support and the need to share and the need to connect. And but I also hear that that's a real concern for people, and I also hear that that's a real fear. But I've talked with a lot of people, and I've served a lot of people on this topic, and I've yet to have anyone say anything that was offensive or outrageous. I also, working with young adults, I created a group with them around this and had it age specific. When we ran the LSR group, or the Love, Sex, Relationship group, we had a structured group where it was the same with everybody, didn't matter how old, didn't matter anything. But then I tailored stuff specifically working with young adults. And, you know, people were bringing up topics of, you know, engaging in kink and going to kink clubs in Vancouver, and sexting. And I remember having a conversation, we were having a craft and we were making like hair pieces, and I was just quiet for a minute and listening to them back and forth. And it was the ladies group talking about sex on chat, sex via video, and all this stuff. And I was like, well, what's the difference? What? And they're like, oh, Tara, sexting's really boring. You don't want to just write, you want it on video. And I was like, whoa, okay. So sitting back and listening to the people and going, okay, so, and I had 6 women with me, and they were all saying that sexting is boring and it's way better on video. And I said, well, how do you know who's on the other end of that video? It's like, well, it's a chat room, Tara. It's on a webinar. It's on their computer. I'm like, You see Bob. How do you know Bob doesn't have 10 friends that are all watching you? And it's online, and it's there and they were like, we never thought about that. So it was really interesting doing a craft. All of a sudden, someone's giggling, and I'm like, what's going on in the corner over there? Oh, I'm just chatting with someone. I'm like, what's happening? And it's like, well, we're setting something up for later. And then it just exploded into this, Bob and I are setting up a video chat for later. And I was like, whoa, hold on a minute. I'm really about safety and about consent and about information's power. And so because it was comfortable for me, and because they had that level of comfort with me, a really powerful, important conversation happened over making hair pieces. And I really wanted to make sure that I was promoting a safe place. And so this will be my last story that I share before we open up for conversation. And during week 4, we talk about STI testing and where you can get testing, and how important it is to be empowered to take care of your body. And it was a busy day at Echo, and all of a sudden she came running in and she had a cotton ball taped to her arm, and she was, look at Tara, look at my arm. And I'm like, I don't know what we're talking about. What's going on, you know? And she's like, I went and got the test. And again, I'm like, what? And I was so out of context. And she's like, the sex test. I'm like, oh. I'm like, you went and had your STI testing. And she's like, yeah, and that HIV thing. I've never done it before. This is a woman who is 32. And I said, well, how do you feel? She's like, it really hit a chord in me when you said that this is my body and that I need to take care of my body. I need to be empowered to take care of my body. And I'm so grateful. And it was just so normalized. I was like, go and get your STI testing done, get HIV. And went to the doctor, got her blood work, ran to Echo, came in, gave me a big hug. Look what I did. I did it. I'm empowered. I feel good about my body. And that was the culture that I promoted. It was really normalized. And that's the message I'm trying to convey, is to meet the people where they're at, hear them, listen to them, support them, know your limitations, know your edges, know your team, and try to tackle this together. And the clients we serve, that's the power, that's the goodness, that's the juice right there in terms of, health and wellness and what they need. And I think that there's a real need for this and a real gap in service.
Well, Tara, I think you've gotten us all talking about the juice. I think you've gotten us all thinking about this, and that's really good. So I'm just going to scroll up here a little bit because I know we had some comments. Beginning with a comment from Natasha saying, could educate about the risks of exploitation. So I think that's just back to that earlier conversation. And so we'll just go through some of these, and the next question asks, do you find that 4-week format to be long enough? And the person asks, is the curriculum available? So you may have things to add about that.
In terms of having a conversation with exploitation, I mean, anyone is vulnerable to exploitation. Anyone can be manipulated. I think when there's a desire for connecting and that isolation that most of folks that have mental health challenges really face, there definitely is a risk for that, which is why I'm advocating for this work to be done, because someone might not be aware of what's happening, and as an outside source, hearing people discuss stories, I had a conversation with someone that went on a date with someone and or was planning to go on a date with someone, and she told me that him and his friend were both coming, and I was like, why are 2 men going on a date with you? And she was definitely someone that I was very concerned with. Through conversation, found out that it was lots of this kind of sexual dialogue, and so I was genuinely concerned. You're having conversations around this very explicit sexual texting back and forth. He's telling you that he's bringing a friend. That feels like a really scary red flag. And we had a conversation. She chose not to go on the date, and so there is a risk of exploitation, definitely. In terms of the 4-week group, it's definitely not enough. There's so much work that needs to be done. This group, like I said, the intention behind the group that Peter and I created was to open up the topic. It is meant to be a kind of dipping your toe in the pool, essentially. It's meant to just say, why do you want a relationship? Let's explore what you have to offer. Let's talk about potential places. Let's have some conversation practice. Let's talk about safety. Let's talk about sexual health, just to open up the topic. Sometimes I find that when you run longer groups, whether it's a 6, 8, 10 group, whatever, dropout can happen. And we ran this group 4 consecutive weeks. in the afternoon, a lot of our folks have challenges with sleep, and so we found that an afternoon group for an hour and a half worked well for our clients. I would say do an introductory program like we did, and then see what the interest is. Obviously, do an evaluation and see where people's topics of interest are. That's where the young adult programs around the sexting and that kind of stuff came up, was because I was hearing from the young adults all these kind of normalized topics, and created these little specialty groups. So I think you'll have to figure out your clients in terms of what does retention groups actually look like. And but it's a 4-week group is not enough. I wish I could just, I love this topic. I could just create groups. The curriculum that I wrote was for CMHA in a clubhouse setting. So this particular group that I created is CMHA's work in terms of working in clubhouses. I was really fortunate that Fraser Health believed in this program so much and believed in me and the work that I was promoting that I facilitated a train the trainer. And I'm happy to say that there are over 30 professionals across Fraser Health, and this program is rolled out in 11 clubhouses. Wow. So I am working with other agencies and creating programs for them. And yeah, definitely open to having conversations with people around that work.
Well, congratulations. That's a
Thank
huge, huge accomplishment.
Yeah.
That's great. It sounds like CMHA owns the copyright to that product at this point.
Yes, they do.
But it also sounds like they're trying to disseminate it through the health authority. So that's really remarkable. So
Thank you.
Kudos to you.
Yeah.
That's really fantastic. We have another thought here. Just a comment really about peer pressure, isn't it? Like being a part of something normal. I was also thinking when you were telling the story about the lady who had been testing, just also I guess there's a need to provide support for people as well. So should that be testing prove to be positive or negative, I guess, just providing those wraparound services for that individual as well. While there's excitement in doing that and it being normalized, I guess just really helping that individual process the outcome as well is probably important.
Absolutely. And and I knew someone that I was working with that actually had the herpes virus, and providing her with resources, providing her with information, and also supporting her in the importance of sharing that information with partners. Right. And there's an obligation for safety, and trying to have a conversation with her around what does that look like, and how do you unpack that with a potentially new partner. But yeah, it's great to promote go and get tested, but then like you said, there's
some things around considerations around that as well. Right.
Yeah. Right. And I think, and because I had a really great relationship with people, that the people were coming and talking to me about things.
Right. Yeah. Oh, super. So a comment was that I'm quite comfortable talking about the topics discussed today. However, I have no clue what to tell my clients on starting online dating. And the question came my way recently. Any advice? This person asks.
Definitely. I would go onto the online dating sites themselves. I think, I'm trying to remember, I think like Plenty-ish and maybe even OkCupid, like if you actually just Google online dating support or tips and stuff like that, or specifically on dating sites themselves, they do have kind of online dating suggestions and safety things and stuff like that. So yeah, I would open up the online dating agency or whatever that they want to use and see what's there. And a lot of them have kind of dating tips. A lot of them have safety tips. Even if you just Google like online dating awareness or online dating strategies or tips, there is a lot of stuff online. Even if you look up things around youth, the information for youth really breaks it down into real basic kind of like level 1, essentially, kind of how to or stuff like that. I would recommend looking into those kind of resources.
Super. Yeah. Good advice. And I think also just if this is what people are asking for, then being familiar with that, it sounds like that's just going to be a lot more helpful.
Mm-hmm.
Yeah, so hopefully that was helpful advice from the expert here. Leslie asks, are there any future options of being trained? This is a gap I've identified and something I am currently trying to get started. So super question. Thank you.
Mm-hmm. I am absolutely available to train, to support, to do whatever. I think there's a real need, and like I said, I'm in conversation with a program that supports folks with developmental disabilities, and I'm also in talks with an agency that has mental health clients as well. And I'm available to come in to do some contract work and support staff in having this conversation. I'm definitely available to create programs. Specifically, some people are like, okay, there's a need, but how do I put this program together? And I have been kind of writing curriculum and rechanging and revamping lots of things on this topic. And I love this work. I believe in this work, and definitely am available to have a conversation with your team, even to come in and do a presentation on the need for this work. And then sometimes management likes to have a little gentle encouragement. And so I'm definitely available to come in and present some information to your management, to your agency, to your team on the importance, and can work with you to either facilitate a program for your clients or work with you to create something. Yeah, definitely. It's important work, and I really believe in it, and I'm absolutely available for it.
So Tara, you mentioned on contract, does that mean that there may be just a cost attached to that? Okay, so just to be clear, just so that people anticipate and know that. So I guess people could contact you, and then you can just give them the lay of the land, as it were. Thank you. So it looks like we have some really good comment up here that I want to make sure. The stigma regarding sex in society makes men, women, and children who suffered at the hands of abusers to feel the fault, guilt, shame, and fear of speaking out. Do you address the complex issues of reporting sexual assault?
Yeah, I mean, it's like I said, I couldn't even guess what a percentage would be, but a lot of the folks that I have worked with do have history of trauma and sexual abuse. This is why we do screening. We want to make sure that if people are coming into the group, that people aren't being triggered, and that people aren't walking away feeling like there's harm. And if people are having conversations around having some kind of trauma or some things that are coming up for them, or wanting to engage in connecting sexually with partners, but feeling like their past trauma is a barrier, I definitely refer out, and there are services available. I worked with very closely with Burnaby Family Life. They have incredible programs specifically for women only. I haven't had a chance to look into any resources for men, but they have art programs, one-to-one counseling. There is about a 6-month wait list, which is unfortunate, but there are groups available specifically for women who have a history of sexual trauma. And again, in the group, I do talk about safety protocols and safety practices in terms of, meeting in public, and not bringing them back to your house or going back to their house, and having a call, a buddy system. I know when I'm dating, when I'm having a conversation with my friends who are dating, I'm like, hey, you're meeting this person, they'll send me, this is the picture that I saw on Plenty of Fish, this is who I'm meeting, this is what I know about him, and so I know my girlfriend's going to this Starbucks at 6 o'clock and meeting Joe. I have a picture. I get as much information as I can within my own social group, and I encourage our clients to do the same and to have that safety call. And and if I don't hear from someone and it's 6:30 and I'm supposed to, I'm on the horn and I'm like, what? Sorry, I got cut up. I was just having a good time. I'm like, I'm having a panic attack. I'm like, I want to make sure you're safe, and just I have probably about 10 tips essentially that I give in terms of safety protocol. Just in terms of your physical safety, but also your mental and emotional safety, and disappointment, and how do you manage that? And so yeah, but in terms of actual sexual trauma or assault, I'm not a trauma counselor, and I I know my scope of practice, and I really encourage all of you to know your scope of practice and to refer out, know your resources in your community for sure.
That sounds like very sage advice, Tara. Thank you for that. The question is, have you had any encounters with clients who have received diagnosis of erotomania and any challenges to your response? Any challenges to your response? Thank you for an important presentation, this person says.
Thanks. Erotomania, I'm not familiar with that term. Is that like a sex addict, a sex?
Well, it's more that I think that people may affix a particular persona to an individual and then just really seek that individual out in a fairly obsessive sort of way.
Right.
And so, yeah, they have it.
Yeah. So in week 4, in the sex talk, essentially, we do talk about masturbation and sex and pornography, and we talk about what are people's attitudes and beliefs around that. Where did we learn that? What were we taught? And we do promote it in a sex positive way to say this is a part of sexuality. But then we also go into any kind of obsessive behavior is not healthy, and it's about balance. And Peter would say, if you're spending 12 hours a day in your parents' basement watching pornography and masturbating, that's not super healthy, and we need to have a conversation about that. And again, it's knowing your scope of practice. I myself have not had anyone come to me with any kind of sexual erotic fantasy obsessiveness. Again, I would be referring out. I would say, okay, this is part of who you are. This is I would refer back to their psychiatrist, back to their case managers, because that's beyond my scope of practice. And I really think that, and I really encourage all of you to know what your scope of practice is. And if you're having conversations that you're not comfortable with, that are beyond your scope, you say, this sounds like something I really encourage you to have a conversation with your case manager with. And you can support them in, how do you bring that topic up with your case manager? How do you bring that topic up with your psychiatrist, and support them in the conversation to get support? I myself haven't had that experience, but I would just refer them back to their mental health team.
Yeah. I think also just by identifying those boundaries yourself, I think you're being a really good role model as well, right? That I think people can draw from as well. Stalking could be a behavior. Okay, that's super. Yeah. So I want to say thank you. There may be other questions as we continue the conversation, but I just want to say thanks very much to Tara. Tara kindly mentioned the work of Conquer in 2013, and we do have some slides that are actually available under the resource tab on this psyrehab.ca website. And I think that work really helped us understand just the poignant just that loneliness people really experience, I think, sometimes when living with a mental health issue, and sort of unmet needs in terms of relationships, romance, and intimacy that people just really described really in depth the sense of isolation and the stigma that people experience. And I think your work goes a long, long way to help those of us delivering services and receiving services to break down some of those barriers and to see what within our scope of practice, in the context of working on a team, seems to be something, the kind of service that we can provide for people. So I'm really, really grateful to you for that. Gisela says, thanks, Tara. I'm thrilled. Oopsies. Sometimes the text just jumps about here, sorry. Excellent presentation, and thrilled that you had the chance to advocate for your passion for this vital part of people's lives. Beautifully said. Thank you. Tammy adds, so honest and real. Great presentation. Thank you, Tara. Someone asked if she can share her contact. So maybe we'll just put the computer over here, and absolutely we can just ask Tara to type in her contact. Multitasking you are today. Thank you. Yes. And then our last question here, maybe, what are some of your suggestions for promoting sex positivity within residential care setting?
Yes. So we've we have had a conversation with, or I did have someone ask this question. You know, folks that are working in group homes, and it's really hard because it depends if you're in a group home or you're, you know, some people work in kind of more complex care. Again, I would have a conversation, look at your policies, look at, you know, it's very tricky. Again, it's people's right and their desire, but you know, if you're working in a residential setting and you open up a client's room and they're in there with someone else, there can be some issues with that. So I would have a conversation with, you know, your managers of care in terms of, you know, what are the policies and procedures, and again, encouraging people to connect intimately without actually having sexual intercourse. If someone is wanting to hold someone's hand and they want to, you know, kiss and snuggle, it's a culture thing, right? So I mean, if you're working in a residential setting and you have, you know, other professionals, you need to have a conversation. If you're implementing this, you know, it's a change in culture, and it's people have different belief systems, and this is I really encourage you to have a conversation with your team and with your management and find out what are our protocols. If we have 12 people that are living in a group home, what does that look like if people want to be intimate and connected? That is their home. But again, there's a lot more in play. I would like to, you know, say just advocate for it, have a conversation, and you know, be open. I actually, when I was at the SAR, and you know, I'm in a room with like 12 people, everyone's like, we're sex positive, woo! And one of their facilitators was like, okay, but are you open, and do you suspend judgment when people aren't sharing your values? And that really struck me. I was like, oh, so try not to be what I would call a right fighter. You might be really liberal. It might be like, this is really important and really want to do this work. But it's in your tact on how you open up a conversation, because you want people to be like the buy-in. So yeah, I would just encourage you to open up conversation, advocate, and to hear what management has to say, talk with your staff, and just start the dialogue.
Eileen, add or supporting privacy in a four-bed shared room when couples involved don't shut the curtain. Oh my goodness, right. Yeah, right.
Yeah, it's
tricky.
It is tricky.
Yeah.
And like again, it's normalized, and you know, it's people may or may not have had choice on being in that shared living situation, and so it's how do we support them in that is really tricky and complicated, and there's lots of pieces to it, and I would need more information before I could say anything, because I'm really about assessing, gathering information, and then having a conversation. I can't just say, this is what you should do. It's really about
context.
Yeah, totally. There's so many complex pieces to it, and I'm really just advocating open up dialogue and hold space and try to suspend your judgment and hear what your colleagues have to say, so everyone can try to come from a place of understanding. I think is really important.
That seems like a very important and very great note to end on. Just trying to have that sense of understanding. And on that note, I just want to say a big thank you to everybody in the room. We had about 78 people at one point, and I just want to appreciate your tenacity. I know today was a bit of a rough start, so we're just very grateful that you stayed with us. And I know that Tara's presentation was, for me, certainly well worth it. So woohoo! Thanks, Susan. So thank you, everybody, and a big thanks to Tara. Thank you very much. Yeah. And then thank you to the other lovely people in the room. You'll see Jen, maybe. I don't know if you can see Jen and Manny. So a big thank you to them. And a sincere thank you to Jordan on the line today for just helping us get out of some trouble there. So happy days, and we shall see you in about 2 weeks, December 2nd. December 2nd for our next bit. And then I'm just, Manny's reminding about launching, we're going to have a session on supported education, a series of sessions actually. So we'll tell you more about that. So stay tuned and have a great 2 weeks, and we'll chat soon. You'll know this recording will be up and about in about a week from now. So if you missed part, or I know that some people had a little bit of trouble hearing, so you'll be able to review it at your leisure. Thanks again, Tara. Have a great afternoon. Bye, everybody. Take care.
Bye. Thank you.